Okay, this video is about the potassium. Okay, and we always encounter this in our practice. So, potassium level, as you know, the normal is 3.5 to 4.5 milliequivalent per liter. Okay, now this one, it always makes us confused. So, when the doctor order a KCl elixir, K-Dur 20, and slow K. Okay, so KCl elixir is uh, it is in a liquid formulation, and the doctor will order 20 millimole. Okay, so that's usually a liquid. K-Dur 20 is 20. The doctor usually orders potassium and then it says 20 milliequivalent. So this is in the form of a white pill. Okay, now the doctor sometimes will order potassium. She will not mention, the doctor will not mention if it's a 600 milligram potassium, or sometimes the doctor will order 8 milliequivalent, and this is in the form of a tablet also, which is slightly red in color. So now you will be able to differentiate slow K, potassium chloride SR, okay, and then you have the potassium chloride 1500 milligram SR, K-Dur, slow K, and the potassium chloride elixir. Okay, next. Do you remember that you usually receive an order of Kayexalate, and then you try to find that out in the AccuDose and you cannot find it? It is because Kayexalate is a brand name, and the generic name is sodium polystyrene, and this is the one that you can find in AccuDose. Okay, so Kayexalate is a medication which is used to treat a high level of potassium in your blood. Okay, what happens when you have a high potassium level? So high potassium level is being treated by the doctor right away because it is very dangerous. It will cause irregular heartbeat that will cause a heart attack. Do you remember sometimes when you are doing a vital signs for patient, and then it will record on the vitals that the patient has irregular heartbeat? So you have something in your mind that might be a high potassium level. This is a picture of the Kayexalate, the sodium polystyrene sulfonate. Okay, and usually when the doctor orders this one, we should mix it in a water, or water with honey because of the flavor, but do not mix with potassium containing products such as fruit juice, the ones we have here, like the orange juices, apple juice. Do not mix in that one. Instead, just mix it in a plain water, or sometimes if there's honey, you can add a flavor with honey. Why? Because it may impair the medication's action. Now, usually when we are doing a patient rounds, or we are doing a vital signs, we notice that patient complains of heart palpitations, patient complains of shortness of breathing, or patient complains of a chest pain, nausea, or vomiting, and the common symptoms usually is the irregular heart rate that we usually also see on the blood pressure machine. Okay, so these are the ones that you can observe with the patient. Now you know that there is a problem with the potassium level and patient is having a high potassium.